Hi, this is Cheryl with a video that's looking at a way to connect how you move your hip joint with how you move your shoulder. When we're doing walking, when we're managing balance while walking, this diagonal between hip joint and shoulder is a big part of the walking movement as we walk step by step and gaining some clarity neurologically about how these 2 points are connected, the sort of diagonal line between them, can be a really helpful component of managing balance as you walk. And so I always like to start with a bit of a more concrete visual because people struggle sometimes when you say hip joint. Often we associate hip with the sense of this very bony, crest here, the iliac crest on our pelvis. And if we come down and in, you'll see that in fact, where the leg actually connects with the pelvis is much further in. And so when I position this sort of to match my own anatomy, you can see that this line of how far in your hip joints are much closer actually to the spacing between each eye. So they're much further in on your body. And so it's helpful to kind of landmark from your own, bony crest to come in and see that this place where my legs connect to my pelvis is quite inside. And so this is the diagonal point. This is what we're looking to associate in this exploration of movement. But what I find helpful is to actually do this lying down. So coming into what could be like a sit-up position, but what I'd like you to sort of landmark is this idea of bringing your shoulder point towards this hip joint. And in doing this diagonal, there can almost be a kind of teeter-totter that your hip joint presses down so that you can bring your shoulder point up and cross. So again, this could become a kind of ab exercise, but what I'm more interested in is having the clarity of this line, this association of moving your shoulder to meet your hip joint. And so you could do that very comfortably with a small movement. If you like a bigger movement, try a few beginnings and then have that clarity of how you're connecting one to the other. And for me, this is part of weaving together neurologically a way that you become more integrated in your core as you move. Um, it helps give you a kind of column of balance, but it also gives you a kind of dynamic mobility that if you should lose your balance, you can put this to work to land better.